What's up, party people? Welcome to our live conversation today with Dr. Chris Miller from Plant Based TeleHealth. Dr. Chris, how you doing today?
I'm great. It's great to see you.
It's great to see you too. There's so many things that we can talk about here today, and we're at a unique moment in time where there is more information available to human beings than ever before. But yet, despite that, there's also more diabetes and more heart disease and more cancer and more autoimmune disease than ever before. So it's kind of an interesting situation, right? Because people are looking for information, but yet sometimes information itself is only this helpful, and guidance and coaching and having a doctor in your pocket is really what enables people to make change over the course of time.
For sure. It's more confusing than ever before with all this information out there. So I feel like people are listening to everything and they come in and they're like, what do I do? So
yeah, absolutely. So maybe let's start out with you giving us a little bit of background about yourself. Talk to us about what is your specialty in medicine?
So I actually trained in internal medicine, so adult medicine, and then emergency medicine. I'm an emergency room physician. I worked in the ER for 10 years and love it. Love life in the emergency room where you can take care of no matter what comes through the door. So that's where I was until I started having my own joint pain, swelling, stiffness, all sorts of crazy symptoms from pain with breathing, fevers, rashes, joint pains, and was diagnosed with lupus. And was put on all these immunosuppressives, high-dose steroids, and nothing touched my lupus. It kept getting worse. I kept working in the ER, and I was in so much pain, I couldn't even move to help my patients. So I finally had to step out of the ER, and it was terrible, and I was so heartbroken because I loved my job there. And then I started looking into, well, what can I do? Did I bring this on? No one else in my family has an autoimmune disease, or at least I thought. And so I started researching, and I came up with diet and lifestyle and overhauled my diet. So I went completely plant-based. And from there, I've been tweaking it over the years. And so now my current specialty is lifestyle medicine, which I love, 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 love. And tweaking diets to optimize health, to reduce inflammation. And there's so much out there where it's like, oh, eat a plant-based diet and everything reverses. Well, it doesn't always work that way. And I know a lot of our people out there are like, oh, why am I not perfectly healthy all of a sudden? And so it takes tweaking, and we are individuals. And now I'd love to look at people's nutrition status and what are they absorbing and what's their microbiome like and what's their lifestyle, how much stress do they have, how much do they exercise and sleep. And so really help people optimize their health. And I just love it.
So you basically did a complete flip-flop, because you went from trauma medicine, which is high stress and acute illnesses, to the opposite end of the spectrum, which is chronic disease management, which takes a long time and has effectively no emergency component to it any longer.
But it does, because it's such a high case mortality is these chronic illnesses. But yes, I am now keeping people out of the emergency room. Yeah. But I still am my emergency physicians. When people come to me, my diagnostic brain right away is figuring out what's going on. And that's what we do in the ER. We rapidly try to diagnose someone and get them on the right plan and move them along. And now I'm trying to diagnose people, help them build the right plan, and keep them aging well and out of the ER. And yeah, I had the whole spectrum.
I actually have an emergency situation right now. I don't have enough chickpeas in my mouth. So what would you recommend?
The emergencies still come my way.
Okay. So for those of you who are here with us, we got lots of you guys. Can you put all of your questions in the chat box? Because we're going to, for the next, 27 minutes or so, 25 minutes, we're going to be asking Dr. Chris a whole slew of questions. We might even go to lightning round. This is pretty fun. And we're going to try and extract as much genius out of her as possible. So before we go there, Dr. Chris, you're now working with Plant-Based TeleHealth.com, right?
Yep.
So give our listeners a little bit of an explanation of what is Plant-Based TeleHealth and why would they benefit from interacting with you or any of your other doctors on your team.
Yeah, so I am so lucky to be with Plant-Based TeleHealth. I consider myself that every single day. We are an internet-based company that does telemedicine visits. So we call it telehealth, but they're telemedicine visits. And so people in all 50 states, although right now it's not currently all 50, but it will be very soon. We're so close to getting to all 50 states, and internationally can come and see us. And we do full histories, comprehensive histories, actually find out everything we can about our patients, and including what they eat, how they live, what are their stressors, how much do they sleep, how much socialization do they get, what are their supplements, medications, past medical history, social history, or surgical history, all of that. We get all of that information, and then we help them come up with the most optimal plan to age well, live well, reverse chronic illness, prevent chronic illness. So that's what I'm doing.
That's awesome. That's awesome. I mean, look at this all-star team right here. I mean, I've met every single one of these doctors, and I can tell you, like, this is an incredibly educated and very knowledgeable and very well-informed group of doctors and you guys are all like very mission aligned in that you use a food first approach and use medications, when necessary, but rather than your traditional allopathic medicine or allopathic doctor who tries to treat diseases with pharmaceutical medications as their first line of defense, you guys have a different strategy, right?
Yes, absolutely. So every single one of us is board certified physician, trained in regular medicine initially. And for whatever reason, whether it's a personal issue like myself or people became aware of this and jumped on board, people are now trained and certified in lifestyle or integrated medicine. And we take it very seriously. And I think all of us have seen regular medicine where people just get sicker and sicker and sicker over the years as we try, give them medications, and then over time it devolves into something worse. And now we absolutely look at people's diet, make every diet changes that we can, work with the person to help them optimize that diet, and do everything we can with diet and lifestyle. There's so much with stress and sleep and exercise and activity and all of these things that are crucial to health. And then from there, we do want people to be healthy. So if we have to use medications, then that would be after we've tried to optimize diet and lifestyle.
Right. So you're basically using diet and lifestyle as your first line of, or your first intervention, your first line of defense. And then when necessary, you move towards medications in particular situations. So run us through, what does it look like? I mean, does a telehealth company, meaning somebody who lives in any one of the 50 states can go to the website, make an appointment? What happens after they fill out an appointment, form that you can see on the website right here?
Yeah, so it's almost 50 states, not quite, but it will be soon. But you go to the website, and the first thing you do is you enter your name and your email. So this page right here, your state and your phone number, and you will be able to develop your own portal. And once you have a portal, and it's basically just this. You just fill this out, and then you get invited to have a portal, and everybody gets 100% of people will get invited to have a portal. So once you're in, and that takes usually about 1 day. Once you're in, then you can go to your state that you live in. Like if you live in Illinois or Colorado or Florida, you can go to your state, and then you can see the list of doctors that are board certified in your state. And then you can choose your doctor. You can read about each doctor. I will tell you, every single doctor we've brought on board is very passionate about lifestyle and integrated medicine, very passionate. They practice it themselves. They live it. They live what they teach 100%. And they're good doctors. They're all board certified, real doctors that are going to take your illness, your health very seriously as well. And so you can choose your doctor in your state. And then once you've done that, you go to that person's schedule and you actually book an appointment with them. And you can book the initial appointment 30 minutes or an hour, depending on how complicated you are. If you have a lot going on, you may want an hour, because we really want to get to know you and figure out the best plan for you and help you begin to get it started. But if you have a simple, relatively straightforward problem, you can do a half hour, too, or whatever you can afford, do whatever works for you. And after you've booked your appointment, then you'll get about 5 pages worth of paperwork, because we do that extensive history. And that's super important for us, because we're going to look at all of it. We're going to go over everything about it before your visit, so that when we have this short time together, whether it's 30 or 60 minutes, we can really jump into what is actually going on, what have you been through, and what can we do to optimize it from here. Oh, and then after we do the appointment,
Okay.
If you need labs ordered, we can order labs for you at a Quest or a LabCorp near you, or you can take them to your local hospital. Or if we recommend imaging or testing, we can help with that. And we can help with medications as well. We can order prescriptions in your state. So we function like real doctors. The only thing we can't do is exams, and we don't see emergency patients. So I'm not in the ER anymore. So if you have that emergency chest pain, acute abdominal pain, or something going on that's more emergent, please go see someone near you right away. But otherwise, we'll take everything else.
This is great. So I can speak from firsthand experience because I've actually been a patient of plant-based telehealth now for, I believe it's been 3 years, maybe 3.5 years. And I've had a phenomenal experience with multiple doctors and been able to get all my questions answered, been able to get the prescription medication that I require, which is basically basal insulin and bolus insulin. And it's a seamless process. So you guys are doing a great job, and I absolutely love the service. There's a couple of questions here. Lisa says, this morning I found out that my A1C is 6.5%. I'm looking for an endocrinologist that embraces a plant-based lifestyle. How do I find one? Do you have any suggestions here? Like, do you guys have any endocrinologists on staff, or is it not even necessary to have an endocrinologist, but somebody who's very, very well versed in diabetes?
It depends on how complicated the patient is. Some people do need an endocrinologist if they're getting an insulin pump. They probably want to talk to someone locally about something like that. But a lot of it we can help handle too. With an A1C of 6.5, we certainly could help work with you and get you on the best plan. How to find a plant-based endocrinologist? There are some websites like through PCRM. You could look for a website that has plant-based, different doctors that have signed up. You could look for it through lifestyle, plantbaseddocs.com. That's another website. And there's also a lifestyle medicine website through the Life ACLM that you could look for. So there's a couple different places you can look for a specialist near you. Other than that, yeah, you could talk to one of us if you're ever interested. A lot of us, we're very well trained in diabetes. We see a lot of diabetes patients. And so we could also help you at least get started.
You know, it's funny, actually. I used to have an endocrinologist from the time that I was first diagnosed with type 1 diabetes back in 2002, all the way upwards of like 2000 and somewhere around 2017 or so. And the reason was because when you're diagnosed with diabetes, you're told that an endocrinologist is pretty much the only type of doctor that can solve your problems and that can answer your questions properly. But I came to learn over the course of time that that is not a true statement. And in fact, yes, endocrinologists are very specialized in like all endocrine related issues, but internal medicine doctors are phenomenal. Family practice doctors are phenomenal, and they have 99% of the knowledge of endocrinologists. And just like you said, if you have like very, very, very specific issues, specifically with an insulin pump, then it might make sense to talk to an endocrinologist. But most of the time you can get your questions answered, and you can get phenomenal lifestyle support from non-endocrinologist doctors. So for any of you who, maybe like driving yourself up a wall being like, why are there so few endocrinologists that are plant-based? Just take the endocrinologist out of it and go talk to internal med, go talk to family practice, and go, in my professional opinion, go straight to plant-based telehealth, because these guys are pros. And another thing to think about here is that mastering diabetes and plant-based telehealth are basically married. If they were people, they would be best friends with each other, or they would be a couple and they would be married. Because what you guys talk about and the medical supervision that you give is 100% in line with the nutritional recommendations that we give, right? So there's effectively zero conflict between what we say and what you guys say. And that's why it's so beautiful, because if you are eating a plant-based diet or following the Mastering Diabetes method, then boom, right there, you can go get literally a doctor who has also read the book, who also knows it, who also has a lot of experience in treating all forms of diabetes directly with the plant-based telehealth crew.
Absolutely. Thanks for bringing that up, Cyrus. So we follow, we talk to you guys. You guys have come and given us talks, and we've taken it deeper, talking about some of the cases that we see, some of the really interesting things, some of the improvements that we made in some patients who are struggling. And we share the philosophy. When I see a patient with diabetes, these things, it's great to talk about it when you see us, but really you need the support to keep going, to build your plan, to make sure you're on track. And so while people check in with us pretty regularly, and we see some people from once a week to once a month to whatever works for them, but most of our patients we're sending over to the Mastering Diabetes website to check it out. There's so many resources that are unbelievably helpful for people and can get them on track. And then for more support, they can do the group support, they can do the one-on-one. Obviously, I shouldn't be telling you because you designed it all, but it's so helpful. This is what I do tell my patients. We upload the red light, green light, yellow light food so they have an idea what to choose for. I mean, all the resources that we could imagine are right there to help them optimize the goals once we have talked to them and said, this is the plan. If you're interested in doing food as medicine, which everyone should be, at least to some extent, if this is what you want, then this is how we're going to go about doing it. So we are BFFs forever.
No, I love it. Okay, 2 questions that have come up in the meantime. Number 1, if I live in Canada, can I make an appointment with any of the specialists on the Plant Based TeleHealth crew? And number 2, what insurances do you cover, if any? Can you answer both of those?
I can. So Cindy, you're in Canada. We absolutely see people in Canada. We have a lot of patients in Canada. So we can see people in any country of the world. So that's pretty cool. The only thing is we cannot order medications in your country, and we cannot order tests or lab work or things like that because we're not licensed in your country, but we can talk to you just like we would. We can help you with your plan. We can and encourage what labs we would recommend, and you can go take it to your doctor. And then when you get your results, you bring it back to us and we talk about it. So we absolutely can help you and work with you, and we would be happy to. So you can pick any doctor if you're interested in coming to Plant Based TeleHealth. Some great doctors. Okay. And then the second question was insurance, and we do not take insurance at all right now, although it's something we're working on and we're looking into for the future. But what we do is we give you a super bill with your diagnoses after your visit. Everybody gets a super bill, and they can submit that to their insurance. So you'll get a super bill usually within about a week of your visit, and you can submit that to your insurance. Some insurances cover 100% of our visit. Some insurances don't cover all that much. So you can check with your insurance. It kind of depends on the plan that you have and if you've paid your deductible. But yes, most people get most of or a good amount of the visit covered. If you're Medicare, then you can't submit it. That's the only caveat. So Medicare people cannot, because it's federal, and they will not allow it because we're not Medicare providers. So you absolutely can't if you're Medicare, but everyone else can. So. Okay,
this is really important. I'm very glad you brought this up. A super bill. Think of a super bill as basically a receipt. Okay, you go to you have an appointment with Plant Based TeleHealth. They provide you with a super bill that basically shows you all of the purpose of the appointment, and you take that super bill and you submit it to your insurance company, and you basically say, "Hey, insurance company, can you please reimburse me for this expense that I just incurred out of pocket?" And just like Dr. Miller was saying, most of the time, if you're non-Medicare, your insurance company will cover either 100% or they will cover like a large proportion of that. So even though you are putting the money up, you are going to get reimbursed within a short period of time. So don't let the fact that this is only cash pay get in the way. Okay. If you have insurance, they will still cover it. It just happens to be after the fact rather than getting a pre-approval. That's a big deal.
Absolutely. So many of my patients are super psyched because they're getting reimbursed. So then they can make appointments, and we can have a relationship and work together regularly.
Absolutely. Okay. This is great. Carmela says, I live in Connecticut. There's only one doctor available for Connecticut on your site and not working with Medicare patients. What am I supposed to do? Could I work with a doctor in another state? Could you maybe help out a little bit here?
Yes, Carmela, thank you for that question. That's a great question. And we know that. We're aware, and we're sorry that it's that way right now, but we are working on it. So you have a couple options. One, we have another doctor that's actively getting certified in Connecticut, but it could take like 6 months or something for that to happen. Because it's a process. You have to do all this paperwork and get fingerprinted and pay all this money, and then they have to approve it. So that will happen. That will have a Medicare approved doctor in Connecticut soon. But what you could also do is, depending on how far you live from a border, we have doctors that take Medicare in New Hampshire and Vermont and Massachusetts and Pennsylvania, and I don't know all the states around Connecticut. But we have Medicare doctors who can take you in those states. So you could drive, and then once you cross the border, you could see us there. So those are your options.
Great. That's great. Okay. So help is on the way. And the nice thing is that Connecticut's a small state, so it doesn't take that long to drive
Right.
across the border, maybe
Mhm.
half an hour or so, and then boom, now all of a sudden it works. Okay.
Mhm.
Now there's a couple questions here. Since you're not covered by insurance, if you order medications that and the meds are covered by Medicare, how does that work?
Yeah,
Do you have
that's
any idea?
interesting. So a lot of us are, if we code it the way Medicare would want it coded, so it's special coding for Medicare, they still will pay it. So that is, most people will get their Medicare medications paid for and labs paid for. If you find out it doesn't, there are a few doctors who it doesn't cover, not yet. And if you find out it doesn't, you can always call your insurance, or you go to the lab and ask, and they'll check with your insurance just to make sure that it is covered. If it's not for some reason, then you can always get your labs done through your doctor locally.
Mhm.
We would recommend what we would want you to do, and you could go get it through your doctor. But most of us, like mine, for example, if I order labs on a Medicare patient, usually Medicare will pay for it, unless there's a special circumstance or something, but they will pay for those labs.
Okay, that's great. Very helpful. Okay, now let's see. We've got a couple more questions coming in. Somebody asked, Kathleen, she says, in scheduling a new patient visit, what's the difference between a 30-minute visit and a 60-minute visit? What is the difference?
It's pretty big, actually. So 30 minutes. I mean, imagine this. We don't know you, you don't know us. And so we're trying to get to know you, get to know what the issues are, and really understand who you are and what your goals are, and then look at your everything about your past, and then put together an optimal plan for you, whether that means lab testing, whether that's medications, increasing them or reducing them, whether that's the lifestyle plan. What are you going to eat? How are you going to live? What plan are we doing for you, and how are we going to, what are the steps to start doing that? So we're going to try to do that in 30 minutes. And sometimes, if you're pretty straightforward, if you're a type 2 diabetic and you want to see us, we might talk about what are the labs we recommend, what's the plan to get started, and we can do that in 30 minutes. Actually works pretty well. If you're an autoimmune person and you've had lots of different concerns and complaints going on for a long time, we're going to want to know, I'm going to want to know what is going on, what led you to this point, what tests have you had done, what have you tried, what's worked, what hasn't worked, and what really what are your symptoms, what's your gut health like, what's your inflammation status like, what kind of symptoms you're having. This is super important for how we're going to design your plan. And from there, the plan can have several steps, and so we'll want a little time to start outlining that, and then you're going to say, oh my gosh, that sounds awesome, or you're going to say, oh, I might need some help implementing that, and we're going to address that together. So that hour is super helpful for the more complicated or had a lot going on. So, and then you have more time to ask questions and to establish a plan. But 30 minutes works. If that's all you can afford right now, then we'll make it work. We do our best to get it in that 30 minutes, anything we can. And we have some handouts we'll give you, and we'll do our best and make it work for you if that's what you can do.
This is great. Okay. Sam asked a question. She says, my father's dealing with a concern about a pulmonary embolism. I'm trying to figure out what to do. I'm interested in plant-based and holistic health solutions, and I'm conflicted about taking tests from doctors who may not be on board. Would plant-based telehealth work? Would it help? Or is this something that requires an in-person visit with a local physician?
Well, we would definitely help with the diet and lifestyle. So, certain foods are more likely to cause people to form blood clots. And certain foods, like we know, like blueberries and green leafy vegetables, they help prevent blood clots. So, and they help the endothelium, and they reduce cholesterol and whatever whatever you have going on. So, the plant-based foods and the lifestyle, there's a lot you can do for that to prevent another one from happening. That's where we would help you. When you actually have a clot already, then you need to be on blood thinners so that what the blood thinners do are prevent you from having a clot while your body starts to break up that clot. It's actually your body that breaks it up, not the blood thinner, but the blood thinner works hard to prevent another one. Because once you've had one, you're very high risk to have another. And so we use diet and the medication, and I do recommend using both. And some of the medications that people are put on, if it's something like warfarin or Coumadin, those medications interact with green leafy vegetables because it blocks the vitamin K and affects the ability to clot. And so doctors will say, don't eat too many green leafy vegetables. Whereas we say, no, eat your greens. They're going to help you heal and prevent another, but then you might have to take a little more coumadin. So we can absolutely help with that. But we work in conjunction at that point with your local doctor because you do want the testing to find out where it came from. If it came from your heart because you have a hole in your heart or you've had an arrhythmia, well, we got to get that treated. That's a medical thing that needs to be treated. If it came from being sedentary or something else going on, well, we can work with your doctor to do lifestyle to prevent that. So that one is a little bit of both, but I think it's important. You guys, I have been a doctor for a long time. I've worked in the ER, I've done internal medicine, and I've never seen a more powerful medicine than diet and lifestyle. It is honestly hands down the most powerful thing. So if you just did the medications, you're not going to get the results that you will if you do the diet and maybe medications for something like this, at least for a short time, and figure out where is this clot coming from? Why did you have that? What are your risk factors? And take the blood thinner for as long as you need, depending on your risk factor, but also change your diet to optimize everything else and prevent another one and go on to live long and well. So you got to do both.
Yeah, right. So it's a two-pronged approach. There's no question about it. Yeah, and it's actually really good to understand that like there are certain conditions and there are certain sort of like more emergent situations in which getting care from an in-person doctor is necessary. Right. And you guys are remote, number one. And number two, help mainly with diet and lifestyle interventions, like the medical support behind the diet and lifestyle interventions. Right. Mm-hmm. So for anybody here, if there's a potential acute emergency situation, like a life-threatening hypoglycemia or a life-threatening hypotension, definitely it is important to go get care from an in-person doctor. However, we recognize that it can be challenging to find in-person doctors that may be on board with a plant-based lifestyle. And you wouldn't think that that would be such a difficult thing, but in today's world, there seems to be a very small handful of doctors that actually really care about plant-based nutrition or are educated about it. And that's okay. That's why these guys exist. And that's why they've, have such a powerful impact in the chronic disease world in particular. We got a couple more minutes here and got a couple more questions. So Stephen Page says, I'm a veteran and all my care is coordinated, consulted, and paid for through the VA. Do you have a way for veterans to be seen through the VA?
Well, Stephen, it depends. So I have one wonderful patient that comes to mind immediately who's a vet, and we have a good relationship. We've worked together quite a bit. And anytime I have labs to recommend or testing that I would recommend, he goes to his VA and gets it covered. So when he sees me, the visit is not covered. But everything else he does through the VA. So that's what we have established. We don't have anything specific yet, but one of our doctors on board works at the VA herself right now. And so this is something we're looking into, what we can do in the future. But as of right now, we're just having the tests be done through the VA and all the labs and everything so that it's covered.
Okay. Phenomenal. Yeah, sometimes it's funny. There's so many different health systems. There's so many different statuses, so many different, private insurance carriers. And before you know it, you're like, wow, how do I get good help?
We get it. Like we do everything we can to help people optimize payments. So if you're a vet, like we will talk about options and what can we do to minimize the costs that you have to pay out of pocket, but get the best care. Like, is it worth the money you're going to pay us for a 30-minute consult to set you on the right path and to know what test and know what eat and know how to change your life? I would argue it is helpful, but then don't waste any more money. Get all your tests, get all your medications through the VA so that, you're not paying for it and see us as much as you need to, but not more than that. And so I don't know. It's just, we're happy to work with you though. And as we come up with more options, we're going to keep evolving.
Yeah, absolutely. That's the only way you can do it, really. Okay. Here we go. So somebody says, if your CPAP diet is half of normal, if your CPAP diet is a 2.0, does the whole food plant-based diet work as effectively to reduce your A1C? Suzanne, great question. The answer is yes. Here's the deal. Your CPAP diet value can basically be put into like one of three effective categories. The first category is low. CPAP diet low basically means that your CPAP diet value is between 0 and 1 nanogram per mil. The next category is considered medium, and that's basically effectively between 1 and 2 nanograms per mil. And the third category is high, which is basically between 2 and 4 nanograms per mil. Okay. So with an A1C, I'm sorry, with a C peptide of about 2, you're basically right between the medium and high category. And what that means is that you likely have sufficient insulin production coming from your own endogenous pancreas to help control your blood glucose. And what that means is that the first line of business for you would be to eat as close to fully plant-based diet as possible. So you want to do exactly what we described in the Master Diabetes Method: whole food plant-based diet that is absolutely low in fat. It has to be low in fat. Low in fat means 15% of total calories from fat or less. If you can adhere to that diet and you can maintain that diet consistently, that is your best line of defense. If for whatever reason that your blood glucose is still very hard to control in that situation and doesn't seem to be coming down, then it might make sense to go down another path to try and figure out if there's some type of medication that may help, or maybe there's specific medicinal plants that can help lower your blood glucose even more. But what we found is that people who have people who have a C-peptide value that is somewhere greater than about 1.5 have a very, very, very high chance of success when using diet as their primary means of intervention. Okay.
That's so awesome. So for everyone who's on plant-based telehealth, who's listening to this right now, was that not the best answer? So you see why we work so closely with Robby and Cyrus and Mastering Diabetes, because while we can help with drawing the blood work and getting you on the plan, you work with these guys and they are going to help teach you exactly what to eat to get the exact results that we're looking for. We can help you with getting a continuous glucose monitor if you need. We can do lab testing for you if you needed medications, or we can help reduce some if you're already on medications as you follow this plan. But you work with these guys, and it's awesome. I just love listening to you guys talk and explain it so it understand it, and then help everyone get to the goal.
Awesome. Yeah, I feel the same way about you guys, because there's so many things that you guys can talk about that we don't have authority on. So it's a great marriage. We're definitely BFFs, no question. All right, we got time for one last question. And the last question here is, how do I lower my cholesterol even more? So I have high cholesterol, and what's the best way are there any specific foods that I can consume that will actually lower my cholesterol? And it turns out that the supplement that we have made, which is called Amla Green Tea. I don't have a bottle in front of me right now, but Amla Green is literally the tea that contains Indian gooseberries. And Indian gooseberries are the world's most powerful, thank you, on the screen now, the world's most powerful cholesterol reducing food ever discovered. There is no single other food in existence that scientists have discovered that can lower your cholesterol value as effectively as Indian gooseberries. So we took the Indian gooseberry, which tastes not so fun, and we combined it with other ingredients to make it taste fun. And as a result of that, there's 3 different flavors. There's an elderberry flavor, there's a regular flavor combined with green tea, and then there's a hibiscus flavor. Regardless of which flavor you get, it has a very, very, very powerful effect and can help lower your blood glucose, your blood pressure, and your cholesterol level simultaneously. Some people write back to us and they're like, hey, Cyrus, you told me it was going to lower my cholesterol and it didn't work. And I wish I had a one-size-fits-all prescription for all human beings. But the truth is that there is no such thing to the best of my knowledge. So I'd just be very clear. I'm not saying that if you take Amla Green that it will lower your cholesterol. I'm saying that it is something that is very powerful in addition to a whole food plant-based diet that can help reduce your cholesterol even more than eating whole foods themselves. In addition to that, Dr. Miller, do you have any other suggestions for particular supplements or foods that can help lower cholesterol?
Well, I have a lot of thoughts on it. And first of all, we're all genetically different. So your cholesterol is going to have a lot to do with your genetics, how much your liver is actually making your cholesterol, and how much your intestines are actually reabsorbing your cholesterol. So that's going to have a lot to do with what your levels are. And so if we put every single person on a low-fat, whole food, plant-based diet, we will see some people drop their cholesterol, to very optimal, extremely optimal. And we'll see other that are they drop it some. Everybody drops a little bit, but it's still up there. And so then you want to start looking at what's your overall risk. if you are at high risk, if you have chronic inflammation or diabetes or high blood pressure, we can calculate your risk using the ACC risk calculator, and we look at your actual risk. Then we can look at if you have an inflammation at the local blood vessels, and that's through blood testing. If you have an chronic inflammation or blood vessel inflammation or some of these genetic risk factors, then we can actually look and see inside your blood vessel, is the cholesterol level actually sticky, and is it actually sticking to your blood vessels? If it is, then you're higher risk, then we're really going to want to get it down. So we're going to be more aggressive with someone like that than someone who doesn't really have the risk factors. And when we do the imaging, they don't have plaque. It's not sticking. And so with that person, we're not going to worry about just the cholesterol number. We're going to keep them on a healthy diet and lifestyle, and we're not worried about it. But for those that we are worried, what else would I do for diet and lifestyle and supplements? There are some things that I do. So one, I'm looking at your diet. What are you eating? And make sure that you're optimizing that so that you are truly eating low fat. And some people, it's really interesting, eat the low fat diet and the cholesterol actually go up a little bit. And those people actually need a little bit of fat. So for some people, we bring just a little bit of it back in and we see their numbers improve. That's just a handful of people. So the majority of people, it is going to come down with the low fat diet. So one, we're going to make sure we're optimizing your diet. If it's a low HDL, something like that, exercise, really make sure we're optimizing all your lifestyle. But then if you're genetically going to keep making cholesterol, or you're genetically going to recycle your cholesterol, there are some supplements. So amla is great. And I do recommend amla powder and amla green tea for people. So that is helpful for some. For a lot of people, and it's helpful for the anti-inflammatory and the blood sugar control. I mean, on so many levels, it's helpful. But if your liver is still making it and your numbers are still high and you're not getting the results, we can try supplements like bergamot is another particular that I love. Again, I'm leery to recommend supplements to someone I don't know. I like to look at your risk and talk to you about the supplements before I recommend it blankly to everyone. But I do like bergamot, so please work with your doctor. Make sure it's not a risk for you. It really can lower LDL quite a bit, actually, maybe almost 30% in some people, and I've seen dramatic responses. So I recommend 500 milligrams twice a day for people, and that's very effective as well. And the other thing you can do is help, even though we're eating this high fiber diet, for those people who are reabsorbing their cholesterol, helping them with a fiber to help pull the cholesterol, kind of think of it like it sweeps the colon and pulls that cholesterol out, help you excrete it. So something like psyllium, so just a little bit of psyllium with a bunch of water, a big cup full of water, that psyllium can help some people actually pull it out too. So after I assess someone's risk, whether we even need to be this aggressive or not, we might look at some of these supplements, and then we have to retest and see if it's working. And if it is working for a lot of people, that's it, we're done. We keep them on that healthy diet and we got the levels where we needed them, and we reduced their overall risk, and we're at a good place. For others, even that's not enough, and then we have to look at medications, because the number one killer of people is heart disease. And so while diet is number one, light and lifestyle and supplements, and then whatever we have to do to keep people to optimize aging and live a long, healthy, wonderful, awesome life, we'll work with you to do. So that's kind of what I do for the high cholesterol, which we see quite a bit of. So if you have high cholesterol on a plant-based diet, please don't be frustrated. It's a genetic thing with how you make it and how you excrete it, and we can help you with that.
Yes, amazing. So translation, eat more chickpeas. That's what I heard. So
yes, chickpeas and greens always.
This is super helpful. So one more time, if people are interested in talking with Dr. Chris Miller herself or any of her colleagues, just go to plantbasedtelehealth.com and you can register for an appointment there. You can choose a 30-minute appointment. You can choose a 60-minute appointment. It's totally up to you. Even if you have insurance right now, what you can do is you can pay with cash to begin with, and then they'll provide you with a super bill. You can take that super bill and you can get reimbursed, most likely by your private healthcare insurance company. Dr. Chris, it's always fun talking with you. You're a wealth of knowledge. Very, very, very helpful information. If you have any last parting words for this audience, let us know.
Yeah, I would say this. I was super excited to get to come today because we just love you guys so much. And I have a lot of people who come to see me and they say, oh, I'm doing this great plan. It's called Mastering Diabetes. Have you ever heard of it? And so I'm super excited to let everybody out there know that our doctors are all trained in Mastering Diabetes. And we're excited that we have this opportunity to work with you guys and to share the common, really, we're right on board. We share the common teachings of how to be healthy and optimize our blood sugars and our blood pressure and our cholesterol and our lifespan and health span. So thank you for this opportunity, and look forward to working together more.
Absolutely. Hey guys, do me a favor. Dr. Chris is such a wealth of knowledge. She's super helpful. Go to the chat box right now, whichever platform you're on, whether it's Facebook or YouTube. Can you just drop Dr. Chris a thank you? She works super hard, and she has got such a large heart and is so dedicated to helping patients with diabetes, heart disease, cancer, autoimmune diseases, and beyond. So please give her a big thumbs up, a big thank you, and that'll go a long way.
Thank you.
Yes, thank you, Dr. Miller. Very, very helpful. Very helpful. Look at this. There we go. Thanks so much. Best program ever. Thanks for saving my life. Amazing, Deborah. I appreciate you. Thank you from Jolene. Mary says thank you. Eric says thank you. Denise says thank you. Dominique says thank you. Man, this stuff is coming in quick. People love you.
Thank you, everybody. Thanks for coming too.
Yes, you rock. Okay, well, we will hopefully see you sometime soon. And in the meantime, take care. And until next time, as Dr. Chris Miller and Dr. Cyrus are about to say, eat some more chickpeas. As you can tell, I'm probably hungry. I'm a little obsessed with chickpeas, and I'm going to put it out in my mouth right now.
I agree 100%. Yes.
Awesome. All right. Have a great day.
Thank you. Bye, everyone.
Talk soon, guys.